October is Physical Therapy Month, and at Rochester Regional Health, there are many different ways of helping patients recover. That includes aquatic therapy. And this morning, Ashley is getting a look at some of the ways it's done.
Hey, good morning. Yes, we have stayed in the pool. You've got an actual therapy session in here right now this morning. We were showing some of the stuff you do, and we are at the bar here. And what are we going to be doing here at the bar?
So we're going to work on some lower extremity strengthening. Okay. So like PREs, they call them progressive resistive exercises.
Okay.
So what I want you to do, since we're going to work on our back too, is engage your core muscles, good posture, shoulders back, tummy tight. So try to keep your shoulders in line with your hips, okay? Slightly bend the one you're standing on. If you need to, hold on to that bar. If you want to challenge, you can try not to hold on too much. Don't death grip it. And then just lift the other leg, flex your foot, and then just lift it up just high enough to feel it in your hip, okay? And Janet, be very careful. Don't go too high. You don't want to feel the pulling in your back, just the contraction in your hip. Okay, so we'll try usually about 10 of these, trying to keep that knee straight. Okay, if you need the bar, it's there.
What's that?
So keep that straight.
You're not holding on to the bar.
Lock that knee.
The height of one hand.
Okay.
Lock that knee. Keep it straight. Yep.
And
then
the
back
benefits
down.
helping with this. What are the benefits of this?
You're engaging your core muscles, kind of working on balance, posture. Okay, and you're also unweighted too.
Yes.
So you've got the buoyancy of the water assisting you as you're coming up, but then you have to pull down and then contract. Yeah. Slow and controlled. Okay, and then try the other leg as well. And as you're doing this, I just want you to think of staying straight and keeping that core engaged too. Okay?
It gets tricky. It really does.
Balanced it.
Yeah. And for somebody with back pain, the balance helps how? If somebody watching at home is saying, well, how does that help?
Well, if you're getting your core and everything stronger, then you're not going to be falling as much too. So, yeah, and that's why you kind of do the strengthening, get the muscles and the foundation and everything stronger.
And I'm seeing, and we've been watching, Janet, we can see underwater. How does that help, that camera under there for you guys?
So that's kind of a good form of what we call biofeedback. So you can kind of watch your form. I can watch you.
Okay.
And you can also see how you're lifting and contracting those muscles in the correct alignment too.
It's really weird to see that as we're moving.
And it's reversed too. So it's like me looking at you, so it's the opposite leg.
Yeah, I was trying to figure out how is my leg moving.
But we can try sideways too.
Okay,
so try like kicking out. Yeah. Ooh. And so now you're going to feel it on the outside of your hip, right? And then you're also balancing and stabilizing with your other leg.
Ooh.
Don't kick each other.
Wow.
There you go. Good. My little rockets.
Yeah.
And then the other way. Good.
Oh, wow. And again, the benefits of aquatic therapy, you're just reminding folks of those. What are they?
Just, you're doing the same exercises that you would be doing on land, but a lot of the times it's a lot easier. You're more freedom of motion, not as painful, the unweighting with the buoyancy.
Let's show some of the other exercises.
Yeah, so we can do some arm core stuff.
Okay.
So Ashley, why don't you grab those bigger dumbbells?
Okay.
And I've got the paddle set for the easiest resistance for Janet.
Okay.
So as a patient would progress, though, we could change those up. But we're going to start with them all the way open for today.
Okay.
Okay, so we'll keep them open. And then what you want to do is use the wall to kind of brace yourself. Oh boy, I got the little mic on my hip here. Okay, so open your feet up about shoulder width apart.
Okay.
Okay, and then bend your knees, Janet. Okay, and then I want you to follow me. The biggest thing is don't hold your breath, okay? So you're contracting those muscles, but I want you to keep breathing. Whistle, sing, whatever you gotta do. Just keep breathing, okay? All right, and then we're gonna come back down towards the wall. All right?
I want to like lift off, like I can feel the,
Keep those muscles tight. Try to engage your quad muscles a little bit. Yep. And try to keep that tummy nice and tight. So a little cue I always tell people is pretend you have a string in your belly button and someone's pulling from behind. So you're bracing those abs, but you're not holding your breath. You don't want to mess with your blood pressure. You don't want to build up lactic acid. Okay, just keep breathing, slow and controlled.
How's that feel, Janet?
Feels very good.
Feels very good. We're going to have so much more. We're going to be showing you guys coming up next the treadmill that we've been talking about. So we're going to continue some of this and show you the treadmill coming up next, you guys.
Wow. Great to see the benefits of the pool and water and aquatherapy and how that's really benefiting those patients there. The little Rockettes there.